My name is Nadeem Mirza. I'm a psychiatrist by training. I work at Bronson Lakeview Hospital, and I'm part of the neuroscience group. So Alzheimer is a neurological condition. Comes under the umbrella of dementias, and there are different types of dementias, and Alzheimer is the most common type of dementia. The most likely risk is age. So that's the most common cause of dementia. So if you take 100 people between the ages of 65 and 74, some 5 of them would have Alzheimer type of dementia. When you take 100 people between the ages of 75 and 84, the risk increased to 15 to 20, and above 85, 1 in 3 people have the disease. There are other risk factors which include, beside age, if you have history of or family history of dementia, your risk is high. If you have late onset depression, so most people get depressed in their 20s or 30s, but if you have the first time depression in your 50s, those people are shown to be at a higher risk. Other things which are also important, which put you at risk, include uncontrolled diabetes or uncontrolled hypertension or high blood pressure. So signs and symptoms, the most common symptoms initially start with, and it can present mostly with short-term memory. And then it starts affecting your day-to-day life. So the type of symptoms, short-term memory, people have difficulty sometimes finding words. So they know what they want to say, but the word will not come to them. Now remember, these things happen to all of us once in a while, but this is happening on a regular basis. Sometimes people have difficulty in recognizing things, though their vision is fine. So for example, they have worked with microwave all their life, they look at the microwave, they don't recognize it. Or how to use it, even if they recognize it. And the most important part, what we call executive function. So planning, sequencing, and doing things become more difficult, including keeping up with their checkbook, keeping up with their appointments. And when these things start affecting your day-to-day life, then those are the presenting signs or symptoms of dementia. And sometimes it's not the patient who recognizes it, it's the person who's with him, husband, wife, or caregiver, who's the first one who recognizes it. So the diagnosis consists of, first of all, which in every medical condition is important, taking a history. Generally, it's a slow, gradual decline in memory over a period of time. And the important thing is it's not history from the patient, but also from the caregiver or person who knows the patient over a period of time. Also, other things which include a neurological exam, so making sure there's no other medical condition, because dementias are rule-out diagnoses. There are some lab work, including blood tests, to rule out other causes, picture of the brain, an MRI or CT, and also paper and pencil tests. So those are the things which you use to diagnose the dementia. Treatment consists of, there are medications. As it is a neurodegenerative disease, there is no treatment per se in terms of which cures it. But there are medications which have symptomatic treatment, and they are approved by the FDA. Most of these medications are approved for Alzheimer type of dementia. There are some new medications which just came in onto the market. These are called monoclonal antibodies, and they are also available, and they are now called drugs which modify the disease. The hope is that over a period of time, as we get more data, that's what it shows. That's the hope. But for any patient who has dementia, we call this as a chronic disease, like high blood pressure or diabetes. The goal is to keep you as independent as possible, as long as possible, making sure that you're safe. So at Bronson, we have a team, including me as a psychiatrist who sees the patient. We have a nurse practitioner who works with us. We have neuropsychologists. We have neurologists who work in our group, and it's teamwork. And we work together to help you, and not only help you, but also your family, how to deal, and as it is a chronic disease, as you go through different stages, how to best manage and support you and your family. I feel that the teamwork and the people who work with me, including me, we want to help the patients and their family as best as we can and address what their concerns are. Our goal is focused on the best treatment, and it is patient and family centered. Alzheimer or dementias are chronic diseases like high blood pressure, like diabetes. There are medication available which help you able to do things better for a longer period of time. As long as you getting or taking the medications and taking care of yourself good, you'll be able to do well for a long period of time. And the team is there to help support you.